I love the approach we take at InStride. We help kids and their families take their lives back from anxiety and OCD. I've worked with countless kids and teens whose lives have been taken over by anxiety. And usually that means that by the time we meet, they're no longer making decisions based on what matters to them, but they're making decisions based on what OCD and anxiety tell them to do. And this means that they've often stopped doing things that are so important for their development, for their happiness, and for their lives, like going to school, spending time with family, and hanging out with friends. And many of them have gotten to the point where it's hard to leave their house. And that's exactly where exposures can be so helpful. Exposure and response prevention, or ERP, is a key component of cognitive behavioral therapy, which is the gold standard treatment for anxiety and OCD, and it is what we practice here at InStride. Exposure is about gradually facing your fears, one by one. Facing the people, places, things, the situations that bring up feelings of anxiety instead of avoiding them. And when people do exposures, their brains can create new, more adaptive memories that compete against fear and help people resist the urge to do what anxiety and OCD demand. And this is just a fancy way of saying that exposures retrain our brains to no longer be afraid of certain things, so we can live our lives based on what matters to us. Avoidance grows fear. At InStride, we give kids tools to grow their courage, to make exposure part of their everyday life. We teach them the evidence-based exposure model. We help them build a fear and avoidance hierarchy, which is like a treatment roadmap. And we give them an exposure coach who practices exposures with them in the community. And that's what's so cool about virtual exposure therapy. We've got kids going in the community to schools, stores, libraries, video game arcades, doing exposures with their coaches on their portable devices and headphones. And in between sessions, their coaches reach out via text to make sure they're keeping that momentum going. And it works. In fact, research has shown that virtual cognitive behavioral therapy with exposure as its cornerstone is just as effective as in-person care for this population. What has been so gratifying about being a provider at InStride is seeing kids do exposures in the community that I never could have done in-person, in-clinic visits. I have worked with so many kids and teens. Kids and teens with the most severe and debilitating anxiety and OCD, and I have seen them take their lives back through exposure work at InStride. It is remarkable.